So I've been asked to kind of give an update on what's going on Capitol Hill this week, and we've seen a lot of changes over the past about 10 days, so I think now is a great time for this kind of an update. As you probably know, the American Health Care Act passed out of the House of Representatives in May, and we heard a lot from the Senate about how they were going to just write a whole new bill. Unfortunately, what became very clear last week is that the Senate is not going to be writing a new bill. They're going to be making some small, minor tweaks to the House bill and trying to pass that. You may wonder how we know this, given that the Senate bill hasn't been released to the public, and in fact, reports are suggesting it's not going to be released to the public. It's just going to be straight to the Congressional Budget Office. Well, we have been hearing lots from press reports, and I've been talking to a lot of Senate staff. And what we do know is that the major areas of concern we had in the House bill are going to remain. That will be the per capita caps on the Medicaid program, the repeal of the Medicaid expansion, and many of the other protections for people with serious mental illness and for mental illness are going to be taken out of the Affordable Care Act. We're extremely concerned about the per capita caps piece because this is a fundamental change to the way Medicaid is funded by the federal government. Instead of actually paying for health care and for whatever services people who are on Medicaid need, there's going to be a capped amount of money. And effectively, it's going to come down to a 25% cut over the next 10 years to the Medicaid program. $839 billion. There's no way states can continue to provide the services that people with disabilities and people with mental illness on Medicaid need with that kind of a cut. So we're extremely concerned about that, and we're also concerned about the repeal of the Medicaid expansion. About a third of the folks on the Medicaid expansion have a behavioral health condition, and otherwise they just wouldn't have coverage. We're also looking at possible waivers of the essential health benefits, meaning healthcare plans wouldn't have to provide mental health services anymore, and really many, many other harmful things. So that's where we are on Capitol Hill. The end of last week, we saw Senators Capito and Heller both come out in support of per capita capping Medicaid. We were really hoping they might be part of the bulwark, but unfortunately, it's looking like they're going to support the bill. So we're at a very particularly tight time, and we're going to see how this all plays out, but we'll try and keep you guys updated.